Hello guys, look at this question here. Differential diagnosis of retrosternal chest pain. So what are they talking about? So we'll draw our human here and he has a chest, right? So in this chest he has pain, okay, behind the sternum, retrosternal chest pain. Now what have they asked you in this differential diagnosis of retrosternal chest pain? Okay, retrosternal chest pain. Okay, so let us look at why and all it can happen. So let's start off with the most suspected that you should have is I would say based on the symptoms presenting, let us say cardiac itself first, angina pectoris, that is the describing the pain, discomfort, myocardial ischemia. So the ischemia then will become infarction, MI, myocardial infarction, right? So myocarditis or pericarditis, that is the layer of the heart, right? The muscle layer of the heart it has some infection, or pericarditis, the outer layer of the heart has some problem, okay? Pericarditis, okay? Then they are telling you what and all will be the other things along with a retrosternal chest pain. Pericardial effusion, that is there is fluid accumulation, where pericardial effusion means, so between your myocardium and pericardium you will have that fluid, okay, pericardial fluid, there is more fluid, okay. So that is when there is larger effusions that may cause this retrosternal oppression. They didn't say retrosternal pain, but they're saying oppression. Guys, are you with us? So cardiac causes, can you tell? Yeah, see, angina pectoris, myocardial ischemia, myocardial infarction, myocarditis, pericarditis, pericardial effusion. Very good. Here you say that you will do ECG and then you will also do some echo, or you will give some, if you suspect myocardial infarction and all that, you will give what loading dose, aspirin, clopidogrel, atorvastatin, etc. So I'm saying the fillers you will write, okay. Then coming to the next important topic here is heartburn, that is GERD, gastroesophageal reflux disease. The acid from the stomach is coming up and it is causing problem, okay. So that heartburn is happening. So here what you will give, you will tell that person not to lie down immediately after food, keep the pillow up, keep the head up so that the acid doesn't get refluxed, okay. Then you will do some endoscopy, check all this sphincters and all are fine, etc. You'll give them proton pump inhibitors like all your very famous pantoprazole, esomeprazole, etc. There's then what is this? So this will cause postprandial retrosternal discomfort. That is after eating food, that retrosternal discomfort. Okay, after eating food. There can also be esophagitis, which can cause this retrosternal chest pain. Esophagitis. Okay. If there is candidiasis of esophagus, also it can happen in HIV patients. If there is some recent onset retrosternal pain, it could be candidiasis of esophagus. They are saying in especially in HIV patient. Okay. We have completed two main things. Now look at this guy, okay. When you look at this guy, and you look at what is behind the sternum, then you will be able to tell everything. What and all is there behind the sternum, everything can cause this retrosternal pain, okay. So let's go to the next set of the causes, okay. Cough that originates from trachea. So where is your trachea, guys? Just here in the neck, right? So there, if the cough is originating from trachea, then you can have retrosternal chest pain, okay. If there's some mediastinal mass, like some goiter or any type of mediastinal mass, guys, you can have mediastinal mass. I can give you a huge list of those masses. Any of those masses can cause retrosternal chest pain. But the thing is, focus here, guys. In that case, the pain will be insidious in onset. It will not be sudden in onset, okay, because the mass has to grow. Then it will cause the slowly increasing retrosternal chest pain, okay. So the mediastinal masses, okay, what and all can it be? It can be goiter, it can be something to do with the superior vena cava, subclavian artery, thymic tumor, dermoid cyst lymphoma, aortic aneurysm, what else can it be? Germ cell tumor, hiatus hernia, it can be, okay, this hiatus hernia, I think you can write in the exam. Then pericardial cyst, some cyst is there, some tumor is there, some abscess is there, some lesion is there, some aneurysm is there, okay. Then foregut duplication, then some cancerous lesion they are saying can be there, sarcoidosis, okay, hiatus hernia, all this, right, okay. So what and all did you learn here? You will say all the cysts, mass, tumor, lesions, aneurysm, what else, right, all that, okay. They all can cause the mediastinal mass, which can cause the retrosternal chest pain. But remember, what did we say? Insidious. Very good. Insidious in onset, it will be the retrosternal chest pain. Very good. At this stage, you take a deep breath, okay, and relax. Let's your retrosternal chest pain is coming down, right? Very good. Because now we have come to this point here, Lassa fever. See, viral hemorrhagic fever. This is what they are saying is in West Africa, if somebody has retrosternal pain, okay, retrosternal pain, if they have pharyngitis, if they have, and if they have proteinuria, the chances that they have Lassa fever is very high, viral hemorrhagic fever. Okay, so we have just included that here because we found it in the textbook. Okay, Lassa fever, viral hemorrhagic fever. Now, what is not mentioned in the textbook and we will write in the exam, right? Standard things that we fill in. There could be some trauma there, right? Or this guy could be having psychogenic, really he doesn't have some panic attack, anxiety or something. And then something to do with the lungs, guys, if you want you can write. Like embolism, pulmonary embolism, pleuritis, pneumothorax, etc. Okay. Behind the sternum, whatever is they blame it, okay. But one thing is this costochondritis, I felt like it is beside the sternum, not behind the sternum. So I put it here. It was not there in the textbook. So guys, we have covered everything that we found. So you have understood now. Cardiac causes, GI causes, cough from trachea, mediastinal masses, all the types of abscess, everything, tumor, everything you will write here in mediastinal mass. Don't forget to mention goiter. Lassa fever can cause this. Okay, then what is not mentioned in the textbook? Trauma, psychogenic, panic attack, and anxiety, pulmonary causes like embolism, pleuritis, pneumothorax. Okay, thank you. Bye bye.